One of the conditions that we treat is aneurysm disease. What is an aneurysm? Well, an aneurysm is basically a blood vessel that has gotten too big. In essence, when a blood vessel gets too big, its wall weakens, and when that wall weakens, it basically ruptures. Now, depending on where that aneurysm is, if it ruptures, that could mean instant death. And so aneurysms are very serious conditions. The question is, what aneurysms are at risk for rupturing? And when it comes to aneurysms that involve the abdominal aorta, which is the largest blood vessel in the body, size is the most important determiner of rupture. Aneurysms that are not very big, but bigger than the normal vessel, are usually followed over time until they get to a certain point where we think that the risk of them rupturing is high enough to justify fixing them. But once aneurysms reach that threshold, some form of treatment is generally recommended to lower the risk of rupture. The basic goal of fixing an aneurysm is to basically prevent flow into that aneurysm while preserving flow to all of the blood vessels that sort of are around that aneurysm. So there are basically two ways that we treat aneurysms, particularly those that involve the abdominal aorta. One is to treat them from within. So we place a special type of stent that looks like a pair of pants, basically, and we land that stent above the aneurysm and then below the aneurysm so that the legs can continue to get blood flow, but we exclude blood flow into the aneurysm sac so that it does not continue to expand or rupture. Now, not all patients are candidates for that minimally invasive type of procedure, and so a small proportion of our patients will require us to do an open surgery, and we sew a prosthetic tube above the aneurysm and below the aneurysm to achieve that same goal, which is to continue blood flow down to the legs while excluding blood flow into the sac of the aneurysm. When you have the surgery done the minimally invasive way, generally you're in the hospital for one day. You go home the following day, you may have some bruising, you may be a little sore in the groins, and we may limit your heavy lifting and strenuous activity for a couple of weeks, but by and large, you're back to your normal activities after you're discharged from the hospital the day after. Now, some patients will have complications related to it, and they may have to stay in the hospital a little bit longer, but most patients get to go home the next day. When you have the open surgery, it does require a more lengthy stay, usually about 5 to 7 days, with some of that time being spent in the hospital. The recovery is a bit longer, and your ability to eat will be limited for a couple of days. You will be a lot more sore because you're recovering from an incision on your belly. But after about a couple of weeks, that soreness starts to wane, and you start to increase your activities. Now, your recovery, your full recovery after that type of surgery can take anywhere from 3 months to 6 months to be fully recovered in terms of you feeling like your normal self again.